As the PPPC crafted its manifesto, it laid out ambitious plans to improve primary healthcare and expand medical services across the country. But as it assumed office on August 2, 2020, the country and the world were confronted with the COVID-19 pandemic, which was wreaking havoc on every economy across the globe. The government, however, wasted no effort or resource in devising and implementing a comprehensive strategy to deal with the economic, social, and health effects of the virus. The PPPC government immediately allocated $4.5 billion to combat COVID-19. Funds were also mobilized from international agencies for the same purpose. A significant sum of this allocation was spent on outfitting and equipping the Infectious Diseases Hospital, which serves as the isolation and treatment center for COVID-19.
We have streamlined the laboratory to ensure that we can do more testing. And we have placed more kits, testing kits, in the various regions. So what we actually have been doing over the last couple of days is testing more people.
The government was able in a matter of weeks to increase the testing capacity of the National Public Health Reference Laboratory from 21 tests per day under the former administration to 2,000 PCR tests per day, with approximately 96 samples processed every 3 hours. 100,000 tests have been conducted in just the first half of this year. As the fight against COVID ramped up, vaccines became available. The administration, in a bid to protect its citizens and ensure that herd immunity against the virus is achieved, has been sourcing and purchasing adequate amounts to immunize the entire adult population.
Right now, they're finalizing the logistics to bring that 200,000 in. We have established the supply chain. We have established the storage facility. We had meetings with the private sector because we have to bring all the storage capacity together to get this done. We are sparing no effort and we are sparing no resource in getting the vaccines here.
A robust vaccination campaign was then rolled out across every region of the country, first targeting the elderly, then later persons who were over 45 years, before becoming available to every person above the age of 18 years.
Like a lot of Guyanese could come out and get a vaccine, be better for them, protect Guyana, and also other people in the country.
I'm a frontline health worker at risk, so that's the reason basically why I take the vaccine too.
If you're not vaccinated, then the possibility is that COVID can be the reality, and COVID is a very serious and a very dangerous thing, and each and every person should at least try as much as possible to protect themselves, protect their family, protect their friends, protect everyone that they come in contact with.
When you take the vaccine and even if you do contact COVID, it helps your immune system will help fight it. So that is the reason why I took it, because it's beneficial to me.
As of the 30th of July, half of the adult population in the country had taken their first dose of a COVID vaccine, while 28% were fully immunized against the deadly disease. And while the pandemic put a damper on training and in-person schooling, government did not allow this to quash its plans to expand its complement of doctors, nurses, pharmacists, medical technologists, technicians, and other support staff. Several training programs for health sector workers were rolled out to ensure they were up to date on clinical guidelines and treatment regimens for COVID-19. Doctors and nurses were trained virtually in treatment and care of patients via collaboration with the World Health Organization and the Pan American Health Organization. And the ministry later restarted its usual programs in dentistry, nursing, and pharmacy. Regional health officers were also trained in clinical treatment guidelines as part of government's plan to run a smooth and successful COVID-19 immunization program. In order to improve access to quality healthcare, adequate infrastructure must be in place. As such, the government, through a public-private sector partnership, commissioned the $245 million Dr. Yesu Prasad Clinical Education Center at the Georgetown Public Hospital Corporation.
This new facility, the Dr. Yesu Prasad Education Center, would allow us to expand our current postgraduate training. We intend to use this building as the teaching hub to provide various online training to doctors and other medical personnel in all of our regions.
The three-level 20,000 square feet structure with a usable roof terrace will serve as a facility for medical education programs offered by the University of Ghana and the GPHC.
We have to fix primary health care. We have to fix primary health care. And to fix that, we have to invest in community health care.
With an aim of ensuring that every citizen, no matter their geographic location, is given medical care and attention, the Ministry of Health launched its specialist medical outreaches in all hinterland and remote regions of the country. These outreaches offer a number of services to residents of these communities.
I really appreciate the feel good, but the distance to travel from here is very difficult and very expensive.
To thank the PPP government and all the persons on the team for visiting Malali today and for your services provided today.
It's a long time we didn't see this service.
Government also commenced upgrades to several health centers and health institutions across the country. Among them are the Enmore Polyclinic, the Festival City Health Center, the Chedi Jagan Dental School, and the Maibakuri Cottage Hospital. The government invested $99.8 million to re-equip the National Ophthalmology Hospital in Port Morant, the only one of its kind in the country. Within months, the hospital had its first set of eye surgeries under the new PPPC administration.
Someday may not see a time where I sit on one place fully. I must thank the PP government of coming back to office and get our sight back. That means our life has come back again.
They have done well. I must compliment them, because if every project is going to be like this project, right, then we will have a lot to look out for.
On the infrastructural front, the Diamond Diagnostic Center was upgraded to a smart hospital. Government also commissioned a $30 million health center at Bamia. The chest clinic at Port Morant became operable. And patients needing diagnostic treatment aided by computerized tomography, CT scans, can now access this service at the New Amsterdam Public Hospital free of cost. Health services in Upper Takatu, Upper Essequibo Region 9 also improved with the installation of an ultrasound machine and a digital X-ray unit at the Lethem Regional Hospital. Health transport has also been improved in Karasabai with a $16.7 million ambulance outfitted to traverse the hilly terrain. Kopenang Health Center and the North Pakarima Sub-District also received ATVs to access their remotest communities. Another 7 ATVs and 33 motorcycles were distributed among RHOs in Regions 1, 7, 8 and 9. Despite the challenges posed by the COVID pandemic, the government was also able to successfully roll out its national prevention campaign against filaria, reaching almost 70% of the population.
We were aiming to get at 65%, so we've exceeded it. I want to thank everyone who has been involved in this campaign. I think they did a fabulous job of going out, reaching out to people, encouraging them to take their tablets. And now that they've taken the tablets, we've been able to accomplish this feat.
In the PPPC's first year in office, a total of $105.2 billion has been expended on healthcare. The government will continue to make the necessary investments to ensure that healthcare becomes accessible, affordable, and available to every citizen.